All right, welcome guys. You're welcome to another enlightening edition of Doctor in the House, where we actually break down the sciences behind our health and also share some expert advice. So today we're going to turn our focus on the nasal area. So it's still all about ENT. This whole time we've been talking about ENT, like I think like 3 episodes or 4 episodes. It's been about the ENT area. So today we're going to be talking about the nose and paranasal sinuses. The nose and paranasal sinuses. Last time it was about the ears. Now it's all here. Are you ready for it? I'm sure you're ready for it. And if you have any questions, feel free to send it to the WhatsApp number on the screen and we will get to ask the doctor in the house. Talking about the doctor in the house, it's no other person than Brigadier General Dr. Nee Obudai, who's an ENT surgeon. And actually, the ENT surgeon, the director of the Roseburg ENT Clinic in Legon. So you're welcome, sir.
Thank you very much.
How are you?
Doing great.
How's
Happy
everything?
to be here. Still rolling on.
Yeah. Today you came with a friend.
Yes, a very good friend.
Right. What's your friend's name?
Oh, we'll call him Jack for now.
Okay, Jack. All right, guys. If you can see, that's Jack. I'm sure you can all see. Jack is a skull, and he's going to be on today's show with us. All right. He's our model for today. Don't be scared. Yeah.
Exactly.
You're welcome, Jack. Anyway, Doc. So today we're going to be talking about the nose.
Nose.
What's so special about the nose?
We want to push it as we left the ear, push it into the nose area. Tell us what that is all also about, the functions that they play, critical function that the nose also plays, with the adjoining paranasal sinuses, kind of holes in the skull around the nose that contribute to the whole system of the function of the nose, basically to breathe and to smell.
Right. To breathe and to smell.
Principally.
Okay, that's what the nose does, to
Basically.
breathe and to smell. Now let's talk about paranasal sinuses. I've heard so many people say, oh, my sinuses are back. I have sinuses. Oh, what's wrong with you? Sinuses. So first of all, what sinuses? And then we get into paranasal sinus. Let's start with sinuses.
The sinuses are paranasal, so they are paranasal sinuses. So if we look at Jack, now, this is what we're talking about here, right in the middle of the face, the bony skeleton of it. So the nose is right here, and we have 4 pairs of the sinuses. You have the maxillary sinus sitting right here. Right. You have the frontal sitting here, the ethmoid between, and then the sphenoid right at the roof of the nasopharynx. So we have these 4 pairs. They are holes.
So everybody has.
Everybody has. So
sinuses.
If somebody says I have sinus, and I'm like, what I say? Everybody has it.
Oh.
Okay. But what
they make it look
is,
like sinuses are the condition.
It's not a condition. It's a normal feature.
That everybody has.
Everybody has 4 pairs of sinuses.
You see why it's important for us to have this show? Very important for us to have this show.
So when people say I have sinus, it's just like saying I have a head. Oh, no, come on now. Everybody has a head. You know? But what they mean is, they probably have sinusitis, which is an infection of the sinus.
Of the sinus.
Okay.
So we have how many sinuses?
4 pairs of sinuses.
1 here and...
maxillary, frontal, ethmoid between the eyes, and then sphenoid sitting behind.
All right, so we have this here.
Frontal.
Right, and we have...
Below the eyes. Maxillary.
Right.
And then you have between the eyes,
and we have between the eyes, right?
And then behind the ethmoid, you have sphenoidal.
Okay, so
4 pairs.
We have this here, this here, this here, and behind.
The one behind. So there are 4 pairs of the sinuses. And they are all around the nose. So they are paranasal sinuses. And they work together. So we go nose and paranasal sinuses.
See, now that you know, sinuses are not conditions. They're actually a part of your face, that everybody has. So, Doc, thank you for clearing that.
Yeah, that's it. So the structures are clear to see. With the soft tissue gone, you can just see clearly. This one's right sitting here. Right. This one's on top, right up here. Between the eyes, there you have the maxillary. And then right up here, behind the ethmoids, you have the sphenoidal sinuses,
All
4
right.
pairs.
So now let's talk about the condition that a lot of people complain about, the sinusitis, right?
Sinusitis.
Right. Sinusitis. Oh,
Sinusitis.
I should be a doctor.
A big one.
Sinusitis.
Sinusitis.
Does everyone get sinusitis?
Not everyone.
Okay.
Not everyone. Okay. The sinuses, like I've just described, they're hollow, what do you call it, structures around the nose. Okay. They form part of the aesthetics of the face, the structure, the balance, filled with air. Now they are lined
They're filled
with
with air.
Yeah.
Okay.
And they're lined with, what do you call it, the same mucosa lining in the nose, goes into the sinus and comes back. So as a matter of fact, whatever happens in the nasal cavity can happen in the sinuses because they communicate. All the 4 pairs of sinuses open into the nasal cavity. Okay? So now, if there's an infection in the nasal passage, rhinitis is an infection of the nasal lining of the nose. It can go right into the sinuses and create a sinusitis. So that's the infection in the sinus that we are describing as sinusitis.
Wow.
So you can't have that because it's a complication from the nasal cavity issues. It goes there. If the ostia get blocked, it creates problems in the sinuses.
Right.
Okay, because they all communicate. Actually, they empty, they clean up, they push everything into the nasal cavity. You blow your nose out, you scrub, you swallow, whatever. It's coming from the nasal passages and the sinuses.
So why is it that some people, some people get it easily than some others?
Yeah, it's just a feature. It's just a feature of people. The resistances all play a role in all these things. Okay, people's resistances.
So your immune system and all that.
The state of your immune system plays a role in all of that. And what things are irritating you? Something might be irritating you so badly.
You don't even know.
It wouldn't irritate me at all.
Yeah. Like
so
dust,
there are differences.
like furs.
Sorry?
Like dust and
Yeah,
furs.
dust is top of the list.
Okay.
Dust, when it comes to allergens, we talk about the allergens. When it comes to the allergens, dust is top of the list. Okay, and not many people know. Okay, I had a patient who was a teacher in those days that used to use blackboard and chalk kind of thing. She stands there, she writes, she takes the duster, she cleans it, inhales everything, and didn't know that it was a chalk dust that was giving her trouble.
Right.
Okay, so it depends on what it is. So people have different levels of reactions to some of these things, and then it manifests differently.
So what
in
are
their
some
system.
signs of sinusitis?
Pain, number 1.
Pain.
Acute sinusitis will give you pain.
Pain where? On your head. Okay.
Serious headaches. They radiate to different places. You feel pain right up here. The frontal sinuses, necessarily you feel it around the forehead because it's there. The ethmoids, you can feel it in the temple. The sphenoid will go to the occiput or to the temple.
Right.
So pain is number 1.
Okay.
The rhinorrhea or the discharge comes in, but it's not a big feature of it. Okay,
Right.
but typically
What's the rhinorrhea?
Running of the nose.
Oh, the running of the nose.
Watery, running, purulent discharge. Your nose is running. You have rhinorrhea.
So, I think it's very important for people to actually visit the doctor when they have some of these things.
Yes.
Because it seems like everybody I wouldn't say everybody, but
Not everybody.
most of the people that I have met that talk about their sinuses, I have sinuses, it's all the running of the nose.
They probably just have
maybe
rhinitis.
it's not even, exactly.
They probably just have rhinitis. They don't have sinusitis at all. If the nose is running, it's confined to the nasal cavity.
What about nasal congestion?
It comes with the same reaction. It can have a common cold from virus. If you have rhinovirus, coronavirus, adenovirus, it just infects you, your nose will run. If you have allergic reaction, your nose will run. Okay?
So that doesn't
so
mean
the
it's
running of the nose doesn't mean you have sinusitis. Sinusitis will come with the infection of the lining. If it's a chronic one with discharge, sometimes it fills the cavity. Okay? So if you take an X-ray, CT, you see the cavity full of fluid. You know this person has a chronic sinusitis. So it's not all runny nose that is sinusitis. It probably is just plain rhinitis.
Right. All right, so we've talked about things like dust and even the pollution. Now let's talk about the weather. Obviously, we're we are experiencing the cold weather now. It's sort of like a winter, a modified winter that we are going through right now. Yes. So how does that affect your sinuses?
That shouldn't affect your sinuses at all, because whether hot or cold, unless you're exposed to real extreme temperatures.
All right.
But even in those states, the nasal passages, okay, are so adapted to actually warm the air you're breathing in, warm it, humidify it, and clean it. I mean, air goes through so fast, but the nose does that. So if you're breathing in cold, air, the nose is able to adapt it, to warm it up before it gets into the lungs. All right. So mildly cold or warm, the nose takes care of it. Extremely cold, then it affects the nasal passages. Either you start running. You get into a very cold area, actually your nose starts running. You don't have an infection. Your nose is just running, reacting.
Right.
It's something we call vasomotor issues.
Right.
The temperature affecting the vessels, and then the nose can run. So it can affect you, extreme cases.
Right. So talking about the runny nose, is it possible for someone to have a runny nose for a very long time?
There must be a reason for it. You must seek medical attention. If your nose is running, 3 days. A common cold usually 3-4 days. Even without treatment, a common cold can run 3-4 days, dries up, you're good.
Whoa, okay.
If it runs for a week, it runs for 2 weeks, it gets bacterially infected, you're discharging pus. What are you sitting in the house for? Get attention. See the medical team. Let it get properly diagnosed. At best, general practice will help you. But if you're complicated, come on now. See the appropriate people so we know what to do and get it sorted out for you. It cannot run for 3 weeks, without any reason and without any cause and without any treatment. It must be treated, taken care of.
It's actually very important that we have these discussions because it seems like a lot of people have, taken matters into their own hands. They even say they have conditions called sinuses and all that. Yes, we've taken a lot. Anyway, we have some questions here, and thank you very much to you for sending in your questions. Doc will answer them. Hi, my kids and I have regular nose block. How can I do away with it?
What are they exposed to? If it's all of them, there must be something that all of them are exposed to.
True.
Okay? Something that they're exposed to. What is it? Okay? Is it pure dust? No. If I'm not particularly allergic, but there's some insecticides, if you spray it in my room, I'm not entering there for the next 2 hours because I'll react. Okay, so what are they exposed to? Cleaning materials, soap, perfume, kind of fragrances. What are they exposed to? Once it's all of them, that means there's something that they are all exposed to, which they must pay attention to. Because as a matter of fact, if you're reacting to something and you're able to put your finger on it, get it out of your system, your problem is solved.
Right. So another one here, which is quite similar to the question we asked, but similar to also to what you talked about, insecticides. Hello, Doc. I use insecticide spray in December to eradicate cockroaches in my house. Unfortunately, my nose is always blocked till now, from December.
Since December.
What do I do?
That is an extreme reaction. Because it would give you, some irritation, but it would not last for 6 months. Yeah, so it has to be diagnosed, find out what's going on, what other things are playing into it, so that we can really properly diagnose and treat it.
Right. So this one is about going to the ENT surgeon.
Get an ENT, examine your nose, and then know what is going on.
Wow. So good morning, Dr. Obodai. My son has constant nasal congestion, and he has been breathing through his mouth for 2 years now.
How old is this
He
one?
has been on nasal drops and sprays all this while and no improvement. He is 2 years and 5 months.
Okay. This comes directly into the play. It would have been in the next issue, but comes into play. Now, for a kid that age, they usually have adenoids.
Adenoids?
Yeah, that grow at the back of the nose. Okay? Now, the lymphatic tissues, they have their own, purposes combined with the tonsils. So for a kid that age, if he's not breathing through his nose, he's breathing through his mouth. Halfway supposed to going straight for adenoids.
And what are adenoids?
Okay, adenoids are lymphatic tissues. Oh, okay, that's good. If you give me a lateral, the lymphatic tissue, they are sitting at the back of the nose. So when you breathe in through the nose, it goes through the nasopharynx, down the oropharynx, hypopharynx, and then into the lungs.
Oh, the pharynx to the lung.
3 sections of them. Now, if the back of the nose is blocked, that is how come no air is going through.
Here.
Very good. That's how come no air is going through. He's having to breathe through his mouth. Breathing through the mouth is what do you call it? It supports, kind of balance kind of thing. That's not the real route. But you can, an emergency, is breathe through your mouth.
So what happens?
So now, if the nasal passages is totally blocked, we have to now get examined, do surgery, remove the adenoids, and the passage is free. There's sometimes also where the opening of the posterior nasal cavities are closed. They don't open at birth. You have an atresia. So the person from birth cannot breathe through his nose.
Yeah, that's what he's used to.
He's used to breathing through his mouth. Once he closes his mouth, he gets short of oxygen. So this one has to all be examined, diagnosed, and then open the posterior space so that the canal is open, then you can breathe. So for a kid that age, I'll go straight, possibly. It may also have foreign bodies.
Yeah.
And some kids have foreign, we'll come to that later, foreign bodies that go in the nose. They don't tell anybody.
Yeah, because they're kids.
It stays there. The nose runs. Because if you have a kid whose nose is running, purulent, what do you call it, infected, and it's unilateral, 50% of a chance you have a foreign body in there.
Right.
It can stay in there, it can calcify and block the whole nasal passage.
Yeah. I think it's important, to whoever that sent this letter, I think it's important that you go check
Get
it out.
Really,
go
if
to
you
a
have seen
specialist,
an
ENT
get it properly
hospital,
diagnosed.
ENT hospital, and get it properly diagnosed, okay?
Yeah, can be sorted out.
We need this kid to breathe well. All right, so we have another one here. Hi, doctor. Please, what causes bleeding from your nose without pain?
Bleeding from your nose. Now, commonly, if to surprise you to know that common nose picking causes nose bleeding.
Like when you put your hand in.
Poking, you don't know what you're poking, what you're looking for. It causes, that's the mild sections of it, okay? The nature of the vessels you have in there, some sneezing, some of those explosive issues can cause, what do you call it, nosebleed. Foreign bodies in there can cause nosebleeds. But then, if you're an adult and your nose is bleeding repeatedly, it's important to check your blood pressure.
Wow, your blood pressure.
Your blood pressure.
All right. So
depends on your age.
Yeah. Another one here says, this is the last one I'm going to take for now, and then we get into the conversation. I'll probably take some more later. Good morning, Dr. Obodai. Please, I want to know why I often get catarrh immediately after waking up from bed.
It depends on what happened while he or she was asleep. Now, this is another trick. If you have dust allergy, all right, and you sleep with a fan on,
right,
you're just setting yourself up. Because what we do, because we're probably feeling hot, so we put a fan on, and we direct it right onto our bodies. So if you have dust allergy and you have a fan standing out there directly on you, it blows everything into your passages. So by the time you wake up in the morning, you're like that. You're full. Right? It might not be just dust. It may be other fragrances that we just mentioned.
Right.
So it depends on what you're exposed to. All right. And then you wake up in the morning, you're full.
Right. Now let's talk about prevention and home care. How can we actually take better care of our nasal passage?
You must be breathing in. There's a lot of pollution out in the space, all right. But you must, at home, you should be able to control what exactly you're dealing with, okay? And people should be alert enough to know, particularly if anybody has a family history of asthma. Asthma is allergy. So if there's a family history of asthma, members may not necessarily be asthmatic, but they may have a degree of hypersensitivity.
Yeah.
Okay? And if it runs through the family, you're reacting to one particular thing, you might as well put a finger on it, get it out of the system. I had a patient who had a perfume he was using that he was reacting to.
And he didn't know.
He knew it. But he says he loves the perfume.
Oh.
So he will put it on, sneeze, 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 and then get out and go into town.
Well,
okay, so it's important to be aware of what it is, what you're exposed to. Some fragrances from perfumes, from soap, from detergents, it's important to pay attention so you know what is giving you trouble. Cut it out. You're good.
Right. Are there any practical lifestyle practices that, or habits that we can actually, you know, incorporate in our lives to reduce any infection?
With respect to the nasal passages, you know, you're not really controlling so much of what you're breathing in the atmosphere. At home, yes, you can control it. But if you hit the road now,
you can't.
You don't know what hits you. You know, but as much as possible within your own personal space, that you can control.
Right.
And as much as possible, you should be able to make sure what you're breathing in is good enough and doesn't give you trouble.
Right. Anyway, we have some few messages before we actually go. Hi, good morning. Please, for some months now, I have been having severe cold. My nose gets blocked and ear itches. Most times I feel like there's a sore in my head because sometimes when I use the earbud, I see blood stains.
Oh, the earbud has come in again.
Yeah.
You see blood.
Yeah.
The ear will not bleed by itself. So if the ear bleeds by touch or by contact, you may have caused some kind of trouble before the ear bleeds. Ear doesn't bleed on its own.
Yeah, so he's talking about cold,
So getting
blocked
cold,
nose, ear itches, obviously.
it must be some allergy.
Yeah.
It must be some allergy in play. Okay, now, anything that comes across your nose, that makes it run, clear, discharge, that makes it itch, or you start sneezing, you know you're reacting clearly.
Yeah.
All right. So a combination of these things can actually give you nasal congestion, give you blockade. If it extrapolates right into the ear, you know a systemic allergy is in play.
Right. All right. This is a very important one. Is it safe to breastfeed a baby on the 6 months while lying down? I notice my baby's nostrils block when I do that.
Is it okay to breastfeed up to 6 months?
Yeah. Is it okay to breastfeed a baby on the 6 months while lying down? And I notice my baby's nostrils get blocked anytime I do that.
She probably is just covering the baby's nostrils with
the breast.
Yeah.
Exactly.
So that's how come the lying position is difficult, because if she herself is a little drowsy sleeping, she's not paying too much attention. So you put the baby to the breast and you're probably covering his nose or her nose with your breast as well. Okay? Now, if the baby has a blockage, like I described, the back of the nose, they will not be able to breastfeed and breathe, because they need that whole mouth to breathe and to breastfeed at the same time.
Yeah, true.
So they can't. Then you know there's a problem. So if it's you're breastfeeding upright,
and it's okay,
then that's fine.
Okay.
But if you're lying, it's very likely your position is creating trouble.
Yeah, your breast is actually covering the nose.
Probably covering the nose.
So, hi, doctor. My son is always rubbing his nose and eyes. He was initially diagnosed of asthma. He was treated and now declared asthma-free, but he still rubs his nose. What should I do? He's 7 years and 8 months.
Probably doesn't have any status asthmaticus, any asthmatic attacks, but he still has the hypersensitivity.
Oh.
He can still react to some atmospheric things.
Yeah, so what should he do?
Watch out and find out what gives him the trouble. You see, when I interface with patients, I don't give a blanket cover.
Yeah.
Don't do this, don't do this, don't drink ice water, don't do this. No. Let the patient look at it, examine his or her atmosphere, get to know the things that give you trouble.
Yeah.
Okay, that is important.
And that's a lot of things we don't do.
There's a lot of things we don't do. Somebody just tells you, oh, you have a cold, oh, don't drink ice water. Oh, don't eat this.
But maybe it's something else apart from ice water.
It's something else totally. So you need to actually be a little,
aware,
observant, find out what's going on with yourself, know what gives you trouble, and then once you avoid those ones, you're good.
All right. Good morning, doctor. I'm glad to hear you discussing sinusitis today. I've been struggling with breathing difficulties since childhood, and recently I've been experiencing nasal blockage and congestion. Can you explain what causes sinusitis? He actually did. And what are some of the simple home remedies that can help prevent or alleviate symptoms? I greatly appreciate it. I think we did a bit of that.
We did.
Yeah.
The home remedies.
Yeah.
The people who have issues congestions, whatever, they're chewing the fat. They're chewing nearly every ginger they see, they will chew it. Yeah, is it giving you relief? Some of those homemade medications, ginger, add a little honey kind of thing. Is it giving you relief? If it's giving you relief, fine, you're getting along. But is it definitively getting the system treated?
All right.
So some of those homemade preparations must also be actually examined to be sure they're giving the right effects.
All right. So good morning, doctor. What causes nose blockage and discharge from the eye of a 4-year-old?
From the eye?
Yeah.
Yeah.
Nose and eye.
Yeah. If that allergy can go right into the conjunctiva as well.
Oh.
So you can have an allergy that goes through there. You see the nose and the eye are also connected through a duct.
Right.
When you tear up or you cry, the tears go up right into your nose because there's a duct. There's a duct that flows from here.
Yeah, that's the tear duct.
That's a lacrimal duct from the tear point, and it opens into the nose. All right. So allergy spreads that way as well. You can have it in the nasal cavity and goes onto the conjunctiva.
All right.
So for conditions like that, you treat both with eye drops and then with nasal drops, just to be able to.
Okay, we actually have more questions coming in, but I want to say thank you so much for sending all your questions. But these questions will actually be replied next week before we start the next edition of Doctor in the House. So, Doc, what's the tip of the day?
Yeah, the tip for the day, once again, your immediate environment. If it comes to allergy, breathing, and smelling, we haven't talked about smelling, we'll talk about probably next week. When it comes to that, your immediate environment you can control. So if something gives you a trouble, irritation, find out, put a finger on it, get rid of it, and your nasal passages will be free.
All right. And how can people reach out to you?
Yes, Rosberg ENT Clinic can be found at East Legon, directly opposite the Chartered Institute of Bankers. The numbers are my number 0244380802 or 054-772-2195. And you find us, Rosberg ENT Clinic.
All right. Thank you so much. Thank you so much, Doc. It was really nice having you on the show. So, ladies and gentlemen, the doctor in the house was Brigadier General Dr. Neo Budai. And, as you all know, he's the director of Rosberg ENT Clinic at East Legon. So if you have any of your problems, do well to call him and also do well to visit the hospital or stay tuned next week, the same time, for Doctor in the House to get more knowledge on your health. Thank you so much for joining us.